Are you in an abusive relationship with your employer? If you're a doctor, nurse, PA, or NP, you might be dealing with a toxic workplace without even realizing it. I know I definitely used to. So in this video, we're going to talk about the signs of an abusive healthcare employer, what it looks like, and how it impacts you. Then we're going to go over a checklist of 10 red flags that might mean your hospital, clinic, or boss is crossing the line. Finally, we'll talk about how to break free from the cycle of burnout, fear, and toxic leadership. Stick around, this is going to be a good one. As healthcare professionals, we enter this field to help people, but many of us find ourselves trapped in a toxic work environment that exploits our dedication. Instead of being valued for our expertise, we're overworked, underappreciated, and guilted into thinking that burnout is just part of the job. But let me be clear, this is not normal. If your job is making you miserable, anxious, or exhausted beyond repair, you might be in an abusive professional relationship. And just like in personal relationships, the first step to getting out is recognizing the signs. Let's break those down. Toxic healthcare environments thrive on fear, manipulation, and control. If you're in one, you might feel guilt-tripped into sacrificing your health for the job, overloaded with unrealistic patient loads or work hours, and afraid to speak up due to retaliation or blacklisting. I am a perfect example of that, actually. You should know a good job challenges you, but a toxic job breaks you. Let's go over our 10-point checklist of red flags. Number 1, you're expected to work beyond safe limits. That checks for me, such as unsafe nurse-to-patient ratios, 48 to 72-hour shifts with no backup, getting called in on your day off again. And of course, if you push back, you're labeled as not a team player. Number 2, they guilt you for taking time off. The patient needs you. You signed up for this. We're short-staffed again. All these excuses. Meanwhile, your mental and physical health suffer. Number 3, fear is a management tool. If you don't like it, there are plenty of others that'll take your spot. Threats of being replaced, losing shifts, or having privileges revoked. Instead of support, you get constant anxiety. Number 5, although I hate this word, gaslighting is common, and you're told, things aren't that bad. They change protocols without notice, then they blame you for not knowing. They deny conversations or promises they made, even if they're in writing. Lots of these things happen all the time in healthcare. Number 5, you're overloaded without additional compensation. Oh, this is my favorite. Personally, I loved when they would ask us to make a presentation that would consist of 60 slides for an hour, which would take me about 60 hours of work to present a massive topic to your colleagues that has to be really well researched. And it takes you so much time to do this. In fact, I have a great story. One of the first times I did this as an attending, they came up to me afterwards, oh my God, it's so amazing. You did the best job. But I realized, oh my God, this presentation just took me 60 hours to do. And they said, we would love for you to do it next month. And I was like, cool, it took me 60 hours, so I need to get paid for 60 hours. They're like, oh yeah, we don't do that. I'm like, why not? That's ridiculous. That's 5 freaking 12-hour shifts you should be paying me for, not me sitting at home for 60 hours on my computer for absolutely nothing. I already did this shit in residency and med school. So obviously your responsibilities keep growing, but your paycheck doesn't, right? You're expected to do all this admin work, billing, and extra shifts for free. Are you kidding me? Do it for the patients, but when you ask for a raise, zippo, silence, right? Number 6, boundaries don't exist. Texting and calling after hours, charting at home for hours unpaid. It's just one more shift. It's never just one more shift. It's always another shift. It's always taking your weekends, taking your holidays, taking your birthday parties, just over and over again. There's absolutely no boundaries in many of these healthcare jobs. Number 7, then they take credit for your work, right? Your research, your initiatives, your process improvements. Someone else takes credit for this. You save a patient's life and your boss gets the praise. Awesome. Mistakes? All on me. Oh yeah, that was me. Dr. Parker, I don't see in the notes that you clamped the aorta on this patient. Did you clamp the aorta upon opening the chest? Number 8, the rules keep changing. One day the admin loves you. The next, your job is on the line for something like totally trivial. Policies change overnight and you're expected to adjust instantly. They undermine your confidence. Constant micromanaging, unrealistic patient quotas, public humiliation in front of colleagues. Oh, I wonder if you guys have ever experienced that. Like, how about on a weekly or daily basis? It's not really constructive criticism if it totally destroys your morale. Number 10, you stay because of fear, not loyalty. Obviously, I can't afford to leave. I'll never find a better job. Every hospital is like this. I can't find anything in my town. I don't want to move my kids and family. These are some of the exact same excuses people use to stay in abusive relationships. So the question is, after all that, what can you do? If you checked off several of these, you're definitely not alone. Many doctors, probably most doctors, nurses, and PAs feel trapped in toxic workplaces. Believing this is just like part of the profession, right? But here's the truth, it shouldn't be. So what are some steps you can do to break free? First, you have to acknowledge it. The system is broken, and I know many of you know that, but it doesn't have to be. You do have to document everything, and this is actually one of my problems. I hate documenting. Like every minutia thing that I do, obviously I do the regular documentation, but I don't want to document every time I tie my shoes or Sally gives me a side eye. Like that wasn't my style, but I will tell you that caused a lot more problems for me than it should have, because if I would have had those things documented, things would have been very different for me. Of course, I may be still working at a job, so that part is not as good for me, but you get my point. So you should keep records of schedules, conversations, and especially unfair treatment. Second, start building an exit strategy. Whether it's private practice, locums, or a career shift, options give you power. And that's what we often lack in healthcare. We lack the leverage or power, especially for someone like me who's a general surgeon, who there's maybe only 10 general surgeons in a town, or maybe even 2 sometimes. You don't have a lot of options. Or you might think you don't have a lot of options, but you actually do. And this is where I think a lot of us get in our head and think, I'm stuck in this one thing because here's my options. Where if you look outside of that hospital or outside of that town or outside of that state, all of a sudden open up a ton of different options. Also, if you think outside of that specific type of practice, that also opens up a ton of different options for you, which it did for me as well. Also, find support, trusted colleagues, a mentor, or even legal counsel if necessary. And finally, you have to set boundaries. Say no, even if it's uncomfortable. Even if you get the famous guilt trip from your team, you have to set boundaries. Why? Because you deserve better. You didn't spend years in school, residency, or training just to be overworked and undervalued. The healthcare system may be broken, but your well-being doesn't have to be sacrificed to fix it. So have you ever experienced a toxic healthcare job? Drop a yes in the comments if this sounds familiar, and share your story, because the more we talk about it, the more we help others realize they're not alone. And if you want more content on breaking free from toxic jobs in healthcare, building financial freedom, and taking back control of your life, hit that subscribe button, because at the end of the day, your job should take care of you, not destroy you. All right, you guys, thank you so much for watching again, and see you in the next video.